Good morning, everyone. Good morning, Dr. Mahendra Sawant, sir. And good morning to Principal Dr. C.M. Rao, sir. I, Mirza Wasif Beg, fourth year student of Manikchand Pahade Law College, Aurangabad, Maharashtra, feels immense pleasure to be the part of this national level online workshop. As the quote rightly says, train like an athlete, eat like a nutritionist, sleep like a baby, and win like a champion. Taking all these points into consideration, the aim of this workshop is to make sportsperson aware of the status of sports in India and its roadmap for aspiring athletes. Now I request Dr. Sunita Bajpai, Associate Professor of Dr. IBP Mahila College, Aurangabad, to give the welcome address and introduce the theme of this workshop.
Thank you,
Over
Mirza.
to you, ma'am.
Good morning to one and all. Today's chairperson, Professor Dr. Dayanand Kambleji, popularly known as DK Sir. Today's resource person, Dr. Mahendra Savanji from Kerala. Principal of Manikchand Pahade Law College, Dr. Rao Sir. Principal of Sau Indirabai Bhaskarrao Pathak Mahila Mahavidyalaya, Dr. Purohit Madam. Participants of this one-week national workshop, my fellow colleagues, and our dear students. I, Dr. Sunita Bajpai, lecturer of commerce from Dr. Sau Indirabai Bhaskarrao Pathak Mahila Mahavidyalaya, Aurangabad, welcome you all on the fourth day of this online one-week national workshop. This workshop is entitled as Making Sports Persons Aware of the Status of Sports in India and its roadmap for aspiring athletes. MP Law College Aurangabad and IBP Mahila Mahavidyalaya Aurangabad are jointly organizing this one-week online national workshop. At this point, I would like to tell you all very briefly about sports departments, that is host departments of these two organizing colleges. Sports department of MP Law College is headed by very young, devoted Dr. Sachin Deshmukh sir, who's a national coach of hockey. Sports director of Sau Indirabai Bhaskarrao Pathak Mahila College, Miss Manisha Wagmare, is actually a gem. She is pride not only for Marathwada but for entire India. I claim this rightfully because she is the sports director from India who has conquered peaks of highest mountain of the world, that is Mount Everest. I feel this is the time we should be congratulating her. I'm really proud that we are associated with her. She stays in Aurangabad. We have a chance to meet her every day. So we are really proud of her. Young Manisha, congratulations. Our students are also really lucky for having such two outstandingly talented persons with them who guide them every day, every morning, literally. Today also, I suppose Manisha has taken our sports lecture and now she has joined this workshop. Now about this workshop, renowned speakers from all over India are enlightening us, sports persons and others. Today we have our resource person from Kerala. They are telling us about physical education and sports field. Many professional coaches, national and international players, lecturers of physical education from all over India have joined this workshop. Our aim is to provide resources, guidance, and awareness to help players and the society also. This would help in reducing severity of the problems. We cannot say we are going to eradicate it all, but we can face it. And this will help create awareness, and we are trying to help some development at the grassroots level of sports field. Now, without taking much time, I would like to hand over this mic to Mirza Wasim Beg, but not before thanking organizers for giving me this opportunity, for giving welcome address. Thank you all. Over to Mirza Beg.
Thank you, ma'am. Thank you for such introduction of this session. I myself being a sports person, I am aware of the problem faced by players because of doping and unwanted injuries. Our resource person for today's session, Dr. Mahendra Sawant, will enlighten us with the topic doping and sports injuries. Dr. Mahendra Sawant is an associate professor at Sports Authority of India's Lakshmi Bai National College of Physical Education, Trivandrum, Kerala. His educational qualification includes BA Economics, BPEd, MPEd, NET, PGDSM, PGD EPMA, NIS, CCY, ISAC Level 1 and Level 2, and PhD. Also, Sir has various PhD thesis evaluations to his name. He is having 5 years of teaching experience in school and junior college at Nasik, Maharashtra, and 25 years of teaching experience at UG and PG level in Sports Authority of India's Lakshmi Bai National College of Physical Education, Trivandrum, Kerala. Dr. Mahendra Sawant is also a certified yoga trainer. Sir has participated 4 times in All India Inter-University Wrestling Tournament. He has also participated in All India Inter-University Gymnastic event. Also, Sir was a Kabaddi player from Pune University, and there he played many Open Kabaddi Championships in the state of Maharashtra. Sir has participated in 54 various international and national webinars on sports, yoga, and physical education and interacted in the same. He has also worked as a sampling officer at the Sports Authority of India's LNCPE Trivandrum. Dr. Mahendra Sawant has many achievements in marathon races too. Besides himself being an athlete, he is specialized in yoga and stress management, sports management, physical fitness, history of physical education, yoga and meditation, yoga and mental health, yoga and personality development, measurement and evaluation in physical education, etc. I'm very thankful to you, sir, on behalf of all attendees, and we are fortunate to have you here. There is one announcement for the participants. If you have any queries or questions during the session, please text it in the question and answer box. Your questions will be answered by the resource person after the session. Now I request Dr. Mahendra Sawant to take over the platform and enlighten us. Over to you, sir.
Thank you so much, Mr. Mirza. Very young champ, very bold and dynamic, and being a sports person in the land of Marathwada. I'm proud of yourself. It's Mirza's a very lengthy introduction about me. In fact, I'm a very simple person, but the introduction he made, my resume he read, it is really, it gives me a lot of dedication, devotion in my field. Thank you so much, Mirza. A very warm good morning to everyone. First of all, I salute to my Karma Bhumi and Janma Bhumi, Marathwada Vidyapit, Dr. Babasaheb Ambedkar Marathwada Vidyapit, Aurangabad, and of course, my Karma Bhumi, Maharashtra, Pune, Nasik. I feel very proud to be here along with my friends and along with all the organizers. First of all, I would like to congratulate to the esteemed institution Manikchand Pahade Law College, Aurangabad, and Dr. Saur IBP Mahila Kala Mahavidyalaya, Aurangabad, for jointly organizing this faculty development program in this pandemic situation for 1 week online workshop organized by Department of Physical Education and Sports. And the theme they have selected, a tremendous, miraculous, a very fantastic theme, making sports persons aware of the status of sports in India and its roadmap for aspiring athletes. I express my gratitude to the both institutions and their principals and vice principals for giving me an opportunity, an ample opportunity to share with you my views, my knowledge, my experience in the field of dope and sports injury. I also congratulate to the both esteemed institutions, principals and vice principals, organizing committee members, including my friend Dr. Sachin Deshmukh, a very dynamic personality in this field. Also, my friend, and he's a chairperson today in my session, Professor Dr. Dayanand Kamleji, my friend, Professor Madam Vaishali Wagmare, also the convener of this event, Dr. Vasudha Purohit ji, Principal Sir, Dr. C.M. Rao Sir, Principal MP Law College, Aurangabad. It is a great moment. From the bottom of my heart, I congratulate to all the esteemed personalities for organizing such a wonderful event in this pandemic situation. 1 week national level workshop on faculty development program. Fantastic. This is actually beginning, I may say, beginning from the Marathwada land to develop entire faculties in the country in the field of physical education and sports sciences. Thank you very much for giving me an opportunity. Today's my friend, chairperson, Professor Dr. Dayanand Kamleji. I must say respected Dr. Dayanand Kamleji because he is chairperson of this event, and other distinguished personalities. My topic is doping and sports injuries, a very challenging topic. This topic, people, they still never understand this area, what is meant by doping and what is this doping, what is NADA, what is WADA, and how the best way we can prevent sports injuries. That is why we the people from our great country, we never take seriously sports is our fundamental right, as education is our fundamental right. And for that, this my topic actually, which I have selected, doping and sports injuries, how the best way athlete can enjoy athletic life, fitness life. And for that, every physical educationist, every athlete, not only in the country but in the world, must learn a lesson from doping is a great menace for our life, for our country. And sports injuries can be avoided, can be realized, can be cured, and the best principle keeping in mind, prevention is better than cure. So without wasting of time, let me start my session. Doping and sports injuries are a real challenge. Friends, many people, they think that they want to achieve everything in their life. Of course, this is a natural phenomenon. Every human, every individual wants to see progress in his individual life, personal life, but there is no shortcut in life. There is no shortcut. So hard work is the key to success. So people, they want to actually avoid the hard work, and they want to go through shortcut, and they want to achieve more and more name and fame and medals in the international Olympic competitions like Olympic, Asian Games, and various events. So, but after reaching this task, after acquiring this task, they face a lot of difficulties about their mental health problem, physical health problem, and side effects of this doping. Next slide, please. So, dope from Dutch word dope, an alcoholic beverage from grape skins used by Zulu warriors to enhance their power in battle. So previously it was used. So dope, people, they used to think that this is a very common, this is very required for enjoyment and for enhancement of performance. So this was the Dutch word being used previously, and it was prepared by some of the from alcoholic beverages and like that. But doping is usually considered to be the deliberate or accidental use by athletes of substances or techniques that may enhance performance. We know very well, friends. I also forgot to take the name of respected Dr. C.M. Rao sir, I think principal sir. Yeah. So Rao sir and all the panelists and all the participants. Doping is usually considered to be the deliberate or accidental use. So athletes, they never take the blame that they when they have been caught in taking suppose doping, they are telling that by mistake we have taken, accidentally we have taken, but that is not, there is no excuse for that. This is a very, very serious what is a serious thing. What dope should not be taken by the athlete. Next slide, please. Because what nature teaches us, whatever the natural things in life, to live, to enjoy life, is proper sleep, proper food, proper exercise, proper way of jogging, running, movement education. That is all natural phenomenon, and if we go against the nature, then definitely we used to face a lot of health issues, and that should be avoided. And that is why this our we have a national dope control agency, NADA, and also World Dope Control Agency, WADA. So they are trying their level best to control this doping menace in the world and also in our country, to avoid such difficulties by the athletes. Next slide, please. WADA, WADA means World Anti-Doping Agency. This is actually established in 1999. Headquarters is in Montreal, Canada. It was created to promote, coordinate, and monitor the fight against doping in sports in all its forms. Now, friends, as we see that Olympic is the topmost event in the world, Olympic Games, Asian Games. After that, it comes Winter Olympics, Asian Games, and Commonwealth Games, and etc., etc. But there are athletes, those who want to achieve through shortcut, through doping, knowing unknowingly, they put themselves into trouble. And to catch hold them by the Olympic Committee, this WADA has been established in 1999, and it is the headquarters at Montreal, Canada. What was the objectives of by the NADA? This to promote, coordinate, and monitor the fight. So to promote, what promote? Not to take doping. To coordinate between the sports organizations, various countries in the world, that doping is a real, very dangerous menace and to be avoided, and to monitor all the testing laboratories in the world to fight against doping in sports. And that is why 192 countries and more than 570 sporting organizations have signed up with WADA. So WADA is a very topmost agency, World Doping Agency, which controls entire doping menace in the world. Not only it is connected with the national, every nation's NADA, but all the NADA agencies are under the coordination with WADA. Next slide, please. Definition of doping is defined as the occurrence of one or more of the following anti-doping rule violations: presence of a prohibited substance in an athlete's sample, tampering with any part of doping control process, and refusing to submit to sample collection after being notified, trafficking a prohibited substance or method, use or attempted use of prohibited substance or method, possession of prohibited substance or method, failure to file athlete whereabouts information and missed test, administering or attempting to administer a prohibited substance or method to an athlete, complicity in an ADRV prohibited association with sanctioned athlete support personnel. Now, previously, if you see, friends, 20-30 years back, doping was not taken as a serious that much. But nowadays, every athlete, every renowned athlete or elite athlete must go through the testing, because unless and until testing is conducted, the athlete, we cannot prove him he is having he is having under the uh, what is under the danger of the uh, substi- substance abuse, under the what is called red zone of substance abuse. Means sometimes he has taken doping or not, we cannot make sure. For the testing is, suppose we found doubt, or this WADA or NADA has found something, this athlete, international athlete, Olympic level athlete is having certain doubt, his performance is suddenly enhanced, sudden improved, so he or she must be undergone through the proper testing methodology. Next slide, please. What are the bad effects of this substance, consume of substance through doping? That is, and there are actually misconcept by the athletes that because of doping we used to we get some benefits or but the some advantage and disadvantage definitely are there. Advantage are very less, but disadvantage are more. Advantage, suppose performance can be enhanced or performance can be improved, medal can be achieved, but disadvantage to their health is a lot. There are certain substances like diuretics and blood doping and narcotics, alcohol and alcohol, steroids, caffeine. These are, so this is their main intention is to, as per the according to the athlete's opinion, because of this substance performance can be improved, but this is totally contradictory situation comes when there is bad effects. uh, Athletes, after some time, some period, they face a lot of difficulties about their health issues and bad effects due to these substances. Next slide, please. Anabolic steroid, this is one of the most sensitive doping steroid or substance, we may say, mostly testosterone and its derivatives in males and females. What are the bad effects happens in males and females after taking this anabolic steroid? Because in previous also there are many athletes found in taking anabolic steroid, they have been banned for the participating in Olympic and international events for years and years. So in males, it happens, suppose baldness, aggression, breast development, high blood pressure. Like in females, stimulate hair growth on the face and body, suppress or interference with menstrual cycle, possibly leading to infertility, thicken the vocal cords, which causes the voice to deepen, possibly permanently. If pregnant athlete is there, female, interfere with developing fetus too. Next slide, please. Effects of blood doping. Now, blood doping is also a different type of uh, kind of doping for the people that sometimes athletes knowingly, unknowingly they used to take, but it is also very dangerous. It flaws in technique can lead to complications uh, ranging from bacterial infections to fatal reactions. The sharing of needles or blood can lead to diseases such as hepatitis or HIV even. Next slide, please. So blood doping is also most dangerous, like anabolic steroids. Stimulants. There are some stimulant substances arise in body temperature. The body having difficulty cooling down, faster breathing, increasing blood pressure, problems with coordination and balance, violent and aggressive behavior. These are the complications athletes develop. So this is all actually against the nature, against the natural activity, against the natural movement, against the natural principles of biomechanical principles, against the nature of excess physiology principles. And the stimulants also one of the dangerous. Next, please. Diuretics, even it is a dangerous substance. The use of diuretics may cause the athlete to faint and become dizzy, get headaches, feel nauseous, lost coordination and balance, get cramps, have kidney and heart failure also. Even it's very dangerous for kidney and heart failure also. It may happen because of the diuretics. Because even though that some athletes they have taken the high risk, previously they have been taken diuretics and they have been under punishment by WADA. Next, please. Beta blockers. Beta blockers is also one of the most dangerous substances which athlete knowingly unknowingly they have been used, which is very dangerous. Beta blockers act to lower blood pressure, slow the heart rate, steady hand movement. Uh, they may cause harm to athletes with low blood pressure and heart problems, asthma, depressive symptoms such as insomnia, nightmares and depression, sexual dysfunction, tiredness. These are the complications due to beta blockers. I think athletes should not take such dangerous substances to spoil natural uh, athletic health. Next, please. Alcohol, it is we used to feel is very common in the public gatherings and all, but even though it comes under the what is doping involvement, especially alcohol and athlete. If athlete they consume alcohol and they perform, then it is if it is found, it comes under doping punishment. Involvement in sport may actually encourage alcohol consumption. See, once the players, if they have a good winning of championship or competitions, but even after that, after some period, 1 to 3 days, if previously consumption of alcohol is more in body, and if the next day after 2 days event is there, and if it is found maybe some symptoms of alcohol consumption, it comes under the doping, and he may be punished by the MC to ban from the competitions. So alcohol is also it's not so. I would suggest alcohol should not be taken by athletes and even common man also. It is harmful for the health. Involvement in sports may actually encourage alcohol consumption. After game drinks to celebrate wins or commiserate losses. After training drinks, expected to consume some alcohol during sporting events. Sporting stars promoting alcohol. Sport events sponsored by alcohol companies. The link between alcohol and the sporting culture is very strong. Therefore, young athletes may be vulnerable to the misuse of it. So I would suggest for all athletes and all physical educationists, all sports love fraternities, alcohol should not be what is called adopted, or should not be taken, develop an interest to uh, for our health issues, for your performance and for better health. Next, please. Caffeine. Caffeine is sometimes used by athletes to try to hide how tired they are feeling. Covering up this feeling of tiredness can result in injury or sickness. Caffeine is also responsible for a small increase in blood pressure, small increase in blood temperature, and increase in how often a person may need to go to the toilet, making it more difficult to fall asleep, headaches in some athletes. So these are the complications due to caffeine. So caffeine also, it is actually uh, see, it's okay, but sometimes it is an athlete must take a serious view. But if non-athlete or after athletic event, normally used to take the cup of tea and cup of coffee. So the coffee also, this caffeine is involved, but it's not much quantity. So this is also one of the substances during the play situation should not be consumed by an athlete. Next, please. Now, doping and after that sports injuries, why it is actually correlated to each other. Sports injuries, every day millions of people of all ages in the world participate in games and sports activities. From soccer fields to softball, diamonds, courts, it's called playing, but sports activities are more than play. Participation in sports improves physical fitness, coordination, and self-discipline, and gives children individual valuable to learn teamwork. Friends, see, now just previously, before 20, 30 years back, what was physical education, sports and fitness program? Previously also it was there. Even ancient Olympic Games, it started from 776 BC. Then modern Olympic Games, 1896. From those 776 BC, all human beings on the earth, they loved physical activity, no doubt at all. Because physical activity gives us a lot of pleasure, happiness, improvement. It improves all-round development of personality, and it gives us a lot of positive benefits. But after 1896, after modern Olympics, which actually uh, uh, led by Baron Pedy Coubertin, a most honorable and most respected person, the man behind this movement, Olympic movement, because of his great effort, Olympic Games, revival of Olympic Games again conducted and started 1896 onwards regularly. In between, due to First and Second World War, it was disrupted, but again the continuation is there. See, friends, what Olympic Games, Commonwealth Games, Winter Olympic Games, Asian Games, even our in our country, national games, Indian Olympic Games or National Olympic Games, we used to say. This is all. It became a part of our life. Physical education, physical fitness, yoga practices, and indigenous games, wrestling, kabaddi, kho-kho, kalari-payattu, and our Mallakham, Nazim, everything, all traditional activities, it became, even though it was traditionally performed in our most esteemed state, Maharashtra, but it has been gradually spread in rest of the states, and gradually it became a part of our life. And now government, especially uh, at present, our honorable sports minister, most respected Dr. Respected sir Kiran Rijiju sir, and our sports authority of India is encouraging and promoting and developing sports in the country in such a way that all people, they must play, they must involve in physical fitness activities, and that is a Fit India, Hello India, and certain events being conducted, and it is in a very positive response and fruitful response, and the result is coming absolutely 100% participation by the people of our great country. So through this movement education, physical activity, people must enjoy this physical fitness, but at the same time people are not aware that much about the sports injuries. Coming to the point now, participation in sports improves physical fitness, coordination, and self-discipline, and gives children, individuals valuable to learn teamwork. But even though sports injury is a very, very common phenomenon, which we, if you take it as a seriously preventive methodology, or prevention is better than cure, we can avoid sports injuries. Next, please. Sports injuries can be defined as a physical ailment that hinder a person's sport performance and prevent him from performing. It disturbs us. Next, please. Sports injuries, because of sports injuries, we get disturbance. It may be for 1 week, 2 weeks, or 15 days, or even it affects on our performance. So sports injuries should not be invited in taking some of the precautions. Classification of sports injuries. Here, reportable, non-reportable. Sports injuries, reportable, minor, moderately serious. There are minor sports injuries, there are moderate sports injuries, there are serious injuries. Now, non-reportable, acute and chronic, motor trauma and microtrauma, soft tissues and hard tissues, minor and major. Next, please. These are the classification of sports injuries. Types of sports injuries: acute and chronic, minor, moderately serious, minor and major, soft tissue and hard tissue, macrotrauma and microtrauma. Remember, these are actually the types of sports injuries which many people, many athletes do not know. Even they this while playing, sir, I got injury. But how did you get? When did you get? What type of injury? This all sports medicine experts and physiotherapists and medical experts in the, or even sports medicine experts or injury experts, they know better, but they want to spread this information, this knowledge to athletes. Athletes, if get plenty of knowledge, for example, this area, this subject, sports injuries, definitely athlete may prevent. Next, please. Next slide, please. Classification. This is macro trauma, micro trauma. Macro trauma injury, it is the sudden blow on the healthy muscles and tissue of the body. It is also called one-time injury. When macro trauma is not treated proper and the athlete continues to do activity, then it will turn into micro trauma. See, very very important, very very sensitive. We must understand. सबसे पहले हमने इंजुरी को समझना है कि भाई इंजुरी किस प्रकार की है, या तो शुरू में है, या छोटी इंजुरी है, या जस्ट माइनर है, लेकिन वो माइनर है या मेजर है, इट शुड बी ऑब्जर्व्ड अंडर द गाइडेंस एंड सुपरविजन ऑफ स्पोर्ट्स मेडिसिन एक्सपर्ट और डॉक्टर and or physiotherapist or concerned medical officer, and then we can decide. Micro, so from macro to micro, it is very very easy to develop such injury. Even we have a small injury, we are neglecting and we are not paying attention and we are started continuously our activities, it develops into micro. It is overuse injury, it's called overuse injury. It is generally given to repeated small injuries. Next, please. Acute injuries and chronic injuries. Injuries when there is sudden stress on the body with severe pain, that is called acute injuries, and that is ankle sprain, strain back occur suddenly during activity. Chronic injuries are caused by continuous stress on the body part over a long time. For example, tennis elbow. Tennis elbow is very common injuries, but that when it develops from acute to chronic. If the tennis elbow happened immediately, it should be taken seriously. Otherwise, it becomes chronic injury, and then it stops her from playing, from enjoying tennis game, tennis practice, at least for 15 days, even 1 month. Next, please. Hard tissue injury, soft tissue injury, very very important. It includes injuries to bone, cartilages like fractures. Soft tissues, the term soft tissue injury refers to injury to muscles, ligament, and tendons. So soft tissue injury is very common in basketball and even football. But footballers, ligament injury and this tendon injuries are very very common. Next, please. Next slide, please. Minor injuries, major injuries. Minor injuries such as bruises and cuts, and these are common in the contact nature of sports. Major injuries, these are those injuries which can affect the performance of the athlete, like fracture, tear of ligaments. And now, the injury for footballers, when the ligament injury happens, from minor, it may become major. So that is, if athlete or footballers if not taking it as serious view, and if playing is continuously, even after minor ligament injury, it may develop into major. So tear of ligament, it may tear of ligament and it may be develop into major injury. So athlete must be careful about what type of injury, either minor or major. Next, please. Next slide, please. Extrinsic injury, intrinsic injuries. So these are those injuries which derive from internal forces or causes by outside impact. For example, surfaces. Sometimes surface, we suppose facility is not proper. The surface in suppose uneven surface also may develop injury. Change from running on grass to synthetic track. Equipment, poor footwear, unsuitable training shoes, even unsuitable shoe or shoe is not properly tied by lace, and lace should be properly fixed, or even the cold weather with inadequate warm up, even warm up is not properly also may happen into injuries. So friends, this is very very sensitive. It's called extrinsic injury. Intrinsic injuries are concerned with the makeup of the individual person. For example, poor fitness level, chronic fatigue, muscle stiffness. See, there are people, those are not having proper fitness. It's my suggestion to all friends, all experts. Please help them. Please teach them. Please do counseling them. Bring them on the ground. Ask them to walk, jog, stretching. Before jogging, must teach them how to stretch our all the arms and legs and upper part, lower part, and after that, proper warm up. Proper warm up. It avoids injuries. So this extrinsic and intrinsic injuries without warm up should not be started. Next, please. Common sports injuries, soft tissues injuries, bone injuries, joint injuries are very common in Indian athletes, even athletes at international standard. Sprain, bruising, pulls, blisters, cuts, fractures, green stick, transverse, oblique, comminuted, impacted, spiral, dislocation, luxation, subluxation, simple and compound. This simple fracture, compound fracture, we know that these basic words. Next, please. Soft tissue injury reduce local tissues and metabolic demands. See, our body is actually body itself is having a very scientific function. So how the best way we manage pain, how the best way we minimize injuries, how the best way to protect different types of injuries, that is very important. So reduce local tissue and metabolic demands, manage pain, minimize inflation. Soft tissue injuries, this is the aim of the soft tissue injuries. Protect the tissue from further injuries, maintain general level of cardiorespiratory and musculoskeletal fitness and activity. So these are actually very important soft tissue injuries. Next, please. Bone injuries, fractures are very common bone injuries. It happens in the bone. A fracture is a break or a discontinuity in bone. In fracture, there is a complete or partial or complete breakage of bone, which can be classified as follows: close fractures, green stick fracture, oblique fracture. Close fracture, in this the bone breaks, but there is no open wound in the skin. So we cannot see the injury, but it is inside. It is very painful. Green stick fracture and incomplete fracture in which the bone is bent. This is mainly occurs in children. Yeah, because of this, suppose lack of calcium and all. Oblique fracture, a fracture in which bone slopes. Transverse fractures, it is a fracture at a right angle to the bone's axis. A very important. These are the bone injuries. Next, please. To understand, to know these bone injuries, so these are the green stick fracture, oblique fracture, transverse fracture, close fracture. So this close fracture is very common, especially in football, basketball, and all. Suppose even happens in wrestling, competitive sport. Next, please. Open fracture is which the bone is sticking through the skin. There is an associated open wound in the area of fracture. Impacted fracture is one whose ends are driven into each other. This is commonly seen in arm fracture in children. So बच्चों में ज़्यादा impacted fracture जो है ये बच्चों में ज़्यादा पाया जाता है. Comminuted fracture, it is a fracture in which bone fragments in several parts. So these are, unless and until we understand the types of fractures, types of bone injuries, we will not realize. The best way, the best methodology to prevent injury is the proper warm-up, proper fitness exercise, regular fitness exercise, and proper cooling down, and to avoid the explosive movement without warm-up exercise. Next, please. This is a normal bone. This normal fracture happens in bone: transverse, oblique, spiral, comminuted, segmental, avulsed, impacted, torus, green stick fractures. You are watching green stick fractures where a particular cut is there in the bone. Next, please. Joint injuries, subluxation and luxations. A joint in the area where two bones are attached for the purpose of motion of the body, and in partial dislocation, in acute strain with the ligaments. Finally, it may be defined as luxation, actual displacements of the opposing contiguous surfaces make up of a joint. These are also kind of fractures. It happens in shoulder and finger bones. Next, please. There are many causes of sports injury. The reason for injury may be vary from individual to individual and from game to game. Trauma, Indigenous cause, associated factors, lack of knowledge, unscientific training. So unscientific training is very, very, dangerous thing, especially in our country. Also, some sports activities where injury happens due to unscientific training. So friends, please understand unscientific training. Make it scientific training. And for that, even workshops should be conducted, counseling should be given to athletes, and some seminars, conferences to be organized in physical fitness, sports injuries, for this making scientific training. Training methodology should be developed in proper way. Inadequate equipment also happens into injuries. Carelessness, overtraining, overload principles also it happens developed into sports injuries. Next, please. Psychological factors, muscle imbalance, muscle stiffness, climate condition, faulty biomechanics, past injury, lack of physical fitness, footwear. We are playing on the ground, but mentally we are somewhere. Mentally, we are not stable on the ground. We are not making concentration. We are not communicating with our teammates. And these are the factors. Actually, footwear, rigid sole. See, the footwear is very, very important. Rigid sole, heel counter loose, sole too flexible, absence of arch support, even tying of lace improper way, not proper way. So these are the causes for developing injuries in sports activities. Next, please. Prevention of sports injuries. See, prevention is better than cure. In the beginning, I have suggested you, friends, prevention is better than injury. You can avoid by this stretching exercise, particular movement, and take plenty of fluid before physical activity or before the game or after the game. Proper fitness, adequate nutrition, sporting event, warm up, proper warm up, sporting conduct, proper kit. Kit is also very important to avoid injuries. Medical supervision is also very important. I request all the physical educationists of the country, please, you should have, you should acquire much of knowledge about medical supervisions, like first aid, basic knowledge of first aid, basic knowledge of proper physiotherapy, basic knowledge of proper warm-up exercise, basic knowledge of fatigue, how fatigue happens. There are a lot of research have been conducted in fatigue, a lot of research have been conducted in sports injuries. And rest, sleep, adequate sleep, not oversleep, not less sleep affects for sports injury also. It is also one of the causes to develop sports injuries. Next, please. Sleep, protective equipment, adhering to norms, common sense, cool down, proper clothing and footwear, environmental conditions. So this is sleep is also very important. Adequate sleep, not more, not less. Protective equipment is very important. Adhering to norms. Now this you are watching this figure, this particular type of stretching exercise before to start your what is warm up, or even after your play situation, after the game also you can have stretching. Proper clothing and footwear, environmental conditions also, of course, it is connected, it is related. Next, please. Non-surgical, surgical physiotherapy and rehabilitation also very important for the treatment of sports injuries. So physiotherapy also after that with the guidance and observation, supervision of concerned physiotherapy expert for rehabilitation. Non-surgical, surgical sports injuries. Next, please. Price, P-R-I-C-E. Price, P means protect, R rest, I ice, C compression, E elevation. These are the treatment for non-surgical. It includes immobilization with slings, tapes. Sling may mobilize an arm up to shoulder, or rest should be done to avoid further injury. Ice is to be applied to decrease swelling, metabolism, blood circulation. In the situation of immediately inner injury, or we can say inner injury, if swelling is there, immediately first aid ice should be applied. Compression, it can stop bleeding as we can use adhesive and non-adhesive splints. It decreases edema. It promotes lymphatic fluids. External compression increases effectiveness of muscle and pump in aiding venous return. Elevation, elevate the injured part will be compressed. Next, please. Management of sports injuries, very, very important. How to manage? So early diagnosis is very important. Do not be late in making diagnosis. First aid should be, that is a first aid knowledge we must have. We must, I think there should be after corona, after this pandemic situation, when we overcome this from the situation, there should be practically first aid workshop should be conducted for all physical educationists. to avoid. Or first aid, this should be a part of the sports and fitness workshop. It should be knowledge, basic knowledge should be provided to all the participants and by experts to the participants about first aid, immediate management, later management. First aid, see, D means danger, R means response, B means breathing, A means airway, C means circulation. So this is actually very, very important parts of first aid. Convolutions, loosen, tight. So this clothing, if it is tight, it should be loosened, and a particular cushion should be provided to the person's head and lay the person on the ground. Immediately, as soon as the injury happens, if you do not have any knowledge about first aid, please do not handle the patient, or do not handle the injured athlete. You call your experienced coach or particular physiotherapist if it is available. During the important play situation, please be ensure that first aid box, ice, and physiotherapist is available at that time of the event. Next, please. Prevention is better than cure. Friends, again, I repeat, prevention is better than cure. For that, what precautions we have to take? We have to do proper warm-up, proper stretching, proper warm-up, proper regular fitness exercises. And after regular fitness exercise, have a little bit stretching to our upper and lower part of body, and do, at least if you do not get time in pandemic situation, do some yoga asanas. It gives a proper exercise to your body joints for your mental health, your physical health, and for your emotional health, and it will help you definitely. And if you have facility to go on the ground for walking, jogging, definitely you must be aware of that. Exercise, any kind of exercise, cycling, walking, jogging, rope climbing, these are preventive methodology from sports injuries. It will make away your sports injuries. It will be helping your life more healthy, happy, comfortable, long life, and it will be positive life, positive thinking for others. So do not develop any tension. Your stress, everybody is having stress. It will be away stress through the sports exercises, physical activities, physical exercises, and proper knowledge of sports injuries, proper knowledge of doping. Doping should not be encouraged, friends, to our students or athletes. Doping is just like a cancer. Once it starts doping, people, they suffer throughout life. Thank you so much. And once again, all the participants, all my friends, thank you so much, Chairperson, Professor Dr. Dayanand Kambleji, my friend. Thank you so much, Principal Sir, Dr. C.M. Rao Sir. And thank you so much, Professor Manisha Ma'am. Thank you so much for giving me an opportunity to share with you and my friends, participants, on the topic of doping and sports injuries.
Thank you, sir. Today we have with us as our chairperson for today's session, Professor Dr. Dayanand Kamble. Dr. Dayanand Kamble is Director and Head of the Department of Physical Education at SB Arts and Commerce College, Aurangabad, Maharashtra. Earlier, he was Director of Physical Education Department of Dr. Babasaheb Ambedkar, Marathwada University, Aurangabad. Sir passed his BA, BP Ed and MP Ed from Dr. Babasaheb Ambedkar, Marathwada University, Aurangabad. He did his PhD on the topic effects of endurance training in indoor hall and open air on boys between 10 to 14 years of age groups, a comparative study. Sir has written 2 books, namely Principle and History of Physical Education and Biomechanic Applied Kinesiology and Physiology of Exercise. Sir has participated and won in multiple athletic events at divisional, intercollegiate, state, and national level. Also, he has worked as an official in various international sports events like 24th Commonwealth Games, Delhi, Pune International Marathon, Pune, Asian Athletics Grand Prix, Pune, and All-Star Asian Athletics Championship, Delhi. He has also worked as an official and as a coach in various national level sports events. Also, Dr. Dayanand Kamble has countless achievements to his name. We are glad to have you here, sir, and we are thankful to you, sir, for your auspicious presence. Now I request Dayanand Kamble sir to please enlighten us.
Good morning, respected dignitaries, Dr. Rao sir, uh, Dr. Madhukar, and participant. First of all, I congratulate who organized such type of useful workshop for the students. I specially thanks to Dr. My friend Sachin Deshmukh sir and Manisha ma'am who really work hard in the field of physical education. It's my concluding remarks. It's give me immense pleasure to forward my concluding remarks on online lecture, doping and sports injuries, a real challenge by Dr. Mahendra Sawant, Associate Professor, Sai LNCPE, Trivandrum, Kerala. Delivered in online 1 week national level workshop on making sports person aware of the status of the sports in India and its roadmap for aspiring athletes, organized by MP Law College and Dr. Sau IBP Mahila Kala Mahavidyalaya Aurangabad. At the outset, I am very much thankful for Dr. Madhukar Sawant sir for giving such a meaningful and useful information on doping and sports injuries. At the beginning, he has elaborated the meaning of doping and the useful information about World Anti-Doping Agency, that is a WADA. Further, he has nicely elaborated the adverse effect of various type of doping, namely anabolic steroid, blood doping, stimulants, diuretics, beta blocker, alcohol, and caffeine. In the latter part, he has introduced sports injuries, further reportable and non-reportable. Sports injuries are explained in detail. Various types of sports injuries like acute and chronic, minor to moderate and serious, major injuries, soft and hard tissues injuries, macro traumas, micro trauma are explained with suitable example with the related images. Dr. Mahendra Sawant sir has further thrown light on common sports injuries categorized as soft tissues injury, bone injury, joint injury. In the latter section, speaker has revealed various preventive measures to avoid injuries. To name a few, he has briefly discussed the importance of proper fitness, nutritionist warm-up, proper kit, rest, sleep, protective equipment, and cool down to stay away from injuries. Going ahead, in this section, Dr. Mahendra Sawant sir has briefly discussed the non-surgical, surgical, and physiotherapy ways to treating the sports injuries. Price method for treatment for non-surgical sports injuries is explained in detail by the speaker. In the concluding part, Dr. Mahendra Sawant sir has explained the management of sports injuries by means of early diagnosis, first aid, immediate diagnosis management, and later management. All in all, it was a very informative lecture on the burning topic. I once again thanks Dr. Mahendra Sawant sir for sharing such a useful information with the participant. With this, I conclude my remark. Thank you for organizing, giving me such opportunity. Thank you. Thank you so much.
Thank you so much, sir, for your thank you so much, sir, for your wonderful conclusion. Mahendra Sawant, sir, shall I read the questions from the participants?
Yes, please. You're welcome.
Thank you, sir. The first question is, what types of doping tests are performed on athletes?
In our country, the doping test, there are particular scientific doping tests are there. It is under the guidance of NADA, National Doping Agencies, and for international athletes, it is at world level WADA. They have a various different type of scientific doping stages 1, 2, 3, 4 like that. And through this testing, the scientific committee will decide what type of the case is the uh, percentage of dope is available in athletes.
Thank you, sir. The second question is how to cure muscle swelling or inflammation caused during playing.
Muscle swelling is very common injuries during play situation. See, if happens muscle injury, so I have suggested that if muscle injury, first of all, we should see that whether the internal injury or external injury, if the bleeding is there or non-bleeding is there. If bleeding is there, immediately first aid should be applied to stop the bleeding and all. And stop, you should come out from the play and take help of the concerned sports medicine doctor or physiotherapist and first aid box. Then for further treatment. If internal injury is there, you should stop playing and first application of ice. Ice is the best and easy friend. That is why while playing, many people they have some fruits to enjoy after play. We will have a fruits and we'll eat and we'll Cadbury's and we'll eat and we have lime juice and nimbu sharbat, whatever it is available. But ice, people they used to forget to keep ice box during the play situation. As soon as play during the play situation, if any injury happens, internal injury and swelling is there, ice should be applied, and ice must be applied at least every 2 hours. Every 2 hours, ice must be applied. That is the first preventive application. It reduces swelling, it reduces pain, and it will be very, very helpful to cure from the injuries.
Thank you, sir, for solving our queries. Now I request Dr. Sachin Deshmukh, sir, to deliver vote of thanks.
Good afternoon to one and all present on online session. As we come to the closing of 4-day session online national workshop, making sports persons aware of the status of sports in India and its roadmap for the aspiring athletes. It is my pleasure to deliver the vote of thanks to all who have helped make this event successful. At the first, I would like to thank management for giving the permission to us to organizing the workshop collaboration with Mahila College and MP Law College, and courage and support. Thanks to all the respected management members, Marathwada Legal and General Education Society, Aurangabad. On behalf of all organizing team, I sincerely thanks to the chairperson, Professor Dr. Dayanand Kamble sir, nicely conclude the session. On behalf of organizing team, I sincerely thanks to today's renowned speaker, Dr. Mahendra Sawant, for his wonderful talk on sports injury. It is nice to learn basic things for the sports person. On behalf of organizing team, I sincerely welcome address. Thanks to the Dr. Sunita Bajpayee Madam from Mahila College. I am thankful to respected Principal Dr. C.M. Rao sir, always encouraged to take this type of event, and also thanks to the Vasudha Purohit Madam, IBP Mahila College. I also thanks to the technical support from Shubham Jaiswal from our college. I also thanks to anchor our student Mr. Mirza Wasid Beg for his wonderful anchoring for this program. I am thanks to teaching, non-teaching staff. Our sincere thanks to all the participants, delegates who are present on Zoom meeting and YouTube live for the workshop to make it success. To conclude the vote of thanks, let me know once again, thanks to one and all that help us indirectly or indirectly to make this event successful. Thank you very much. Thank you very much, sir. Over to the Vasid.
Thank you, sir. The assignment for today's session will be uploaded on Google Classroom, and I request all the participants to be present at 10:30 a.m. tomorrow for the next session. Thank you, one and all.
Thank you, all of you. Have a nice time.